Stop telling people you don't have a choice. We are, of course, saying this all day long. We're saying it to other people, but more importantly, we're saying it to ourselves. Down through the years, I've been talking to people about their health conditions many times after a crisis. And when I ask them about, let's say, their blood pressure, why it got out of control and why they have been living with it, knowing that it got out of control, many of the replies are, I ran out of my blood pressure medication. I ran out of my insurance. I didn't have a blood pressure machine at home. All sorts of responses that basically say, I didn't have a choice. Now, I'm not beating up on one type of people. This is the human condition. I suggest the main underlying disease, the root of all disease, is this idea that we don't have a choice. So many times when I'm taking care of somebody and they've had, let's say, a condition, I don't want to put a name on it this time, but they get admitted to the hospital, things are out of control, and we are giving medications, but I'm concerned that what's really underlying it is the notion of limited choices. And we can see it when we get ready to discharge people. We can see it all throughout our conversation. In fact, you'll be able to see it all throughout your conversations today. You'll be telling people in various ways, I don't have a choice. And then they'll be nodding and saying also in various ways, they don't have a choice. It's what we do all day long to soothe each other and make us feel better about our circumstances, our experiences. But we're not helping each other beyond that. And what I would suggest, since we've already said and suggested that the root of all disease is this idea, this notion of limited choices, well then part of the therapy, part of the treatment, part of the cure is to help people to realize their leverages of choice, their leverages of control. Let's do that for each other, help each other to realize that perhaps, maybe we should talk to somebody who's a specialist in blood pressure, somebody who's a specialist in, let's say, diabetes, somebody who's a specialist in finances, a specialist in relationships, a specialist in fitness. People know a lot of stuff. Sometimes it's just a matter of aligning with the right people. Sometimes it's a matter of aligning with the right things and going to the right places, right? People, places, and things. And so I hope that you're hearing a theme here. I'm going to recommend that when we describe our experiences, try to hear and listen when we're saying, I don't have a choice. Many times we're not using words like that per se. Maybe we're saying, well, when this happens, blah, 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 In other words, what we're saying is we'll have choices at another time, but right now we don't. Pay attention to how many ways that we are saying, I don't have a choice. And what I just want you to understand is that we are doing it and be able to recognize it with your own ears and your own eyes. Hear yourself saying that, hear it come from others. You'll do it all day long. We make 3,500 choices a day. And so there are a lot of options, lots of opportunities that we talk about our choices and our experience. I want you to hear how we limit ourselves. I want you to hear how we undervalue the choices we have. I want you to hear how we underestimate the number of choices we have. And then I want you to change your language, change how you're looking at it. I want you to talk about your preferences, what you find desirable, and what has been favorable. I want you to think in terms of those three. I want you to change your language, talk about what you prefer. Talk about your preferences, talk about your desires, your wishes, dreams, and also talk about outcomes in terms of their favorability, okay? Now, and I'm not suggesting that everything is going to be exactly the way we wanted it, right? Maybe I was driving down the street and then I thought something was that way, and so I made that turn, and then I realized, you know what? That it didn't take me where I wanted to go. I'm not going to call it the wrong turn, because when I start talking about the wrong turn, then there was a right turn, and now there's two options, and we have more choices than we think. Okay, so that's the point. talk about your preferences, talk about your desires, talk about what's favorable. See if you can change your words, so you can change your ideas, so you can change your vibrational levels, so that you can change your health and your victory. Keep winning, guys. Take care.